and she not having any sort of sense of self.
Fantastic. Good evening, everybody. Welcome to the October 19th Los Angeles City Health Commission meeting. I'm glad everybody can virtually attend, and I appreciate the hard work and dedication of the employees of the City of Los Angeles and our dedicated interns to facilitate and make this happen so that the entire city has the capability of plugging in and asking questions and participating in our health commission. I'd also like to thank the Chief Academic Officer of LAUSD, Allison Yamashimoto Taori, for making herself available this evening. So thank you. Can we have a roll call, please?
Yes, Commission President Mandel.
Present.
Present. Commissioner Grimmick is absent today. Commissioner Osi.
Present.
Second Vice President. Commissioner Avila.
Present.
Commissioner Estradas. Commissioner Estradas. Commissioner Hisarick.
Present.
Commissioner Cato.
Present.
Commissioner Kalfani.
Present.
Commissioner Lemus.
Present.
Commissioner Shannon.
Present.
Commissioner Sirota.
Present.
Commissioner Whittington. We have a quorum.
Thank you, Clerk. Everybody, please, if you could, mute yourselves when you're not speaking so that there's no background echo. Thank you. I've been asked by the head city clerk to read the following statement. Today, Monday, October 19th, is the last day to register to vote for the November 3rd election. Anybody who is registered to vote by today will automatically be mailed a vote by mail ballot. If an individual misses the registration deadline, a conditional voter registration, also known as a CVR, or same day registration, is in fact available at any vote center. Vote by mail ballots must be returned no later than election day, either by mail, by using any official vote by mail drop box, or by taking it to any vote center in the city of Los Angeles. Thank you, and please, for the public, vote, make your voice heard, make your voice heard at the election box, and also make yourself available and have your voice heard at commission and city council meetings. Now they're quite easy via Zoom. We appreciate anybody who's listening in the city. Thank you.
Commission President, I see that the message was cut off when I sent it to you. I just want to make a correction that voters can take their vote by mail ballots to any vote center in the county.
Thank you, Rita. I appreciate the amendment and correction. Moving on, is anybody from the Neighborhood City Council here for a comment? Seeing no Neighborhood Council voices or hands raised, we're open for public comment. Is there anybody in the public comment waiting room?
There's no one here for public comments. President Mandel, you may now proceed with the first agenda item.
Thank you. Appreciate that. Agenda item number 1 is the presentation that will be done today by Allison Yashimoto Taori, who's the Chief Academic Officer of LAUSD. Allison, we're thrilled that you could be here with us tonight. It's all yours.
Thank you so much. Good evening, everybody. Greetings, President Dr. Mandel, Vice Presidents and Commissioners. El Unified Board Member Nick Melvoin was called away on business this evening. Therefore, I'll be speaking on behalf of the El Unified School District. My name is Allison Yoshimoto Tauri, the Chief Academic Officer. And this evening, I was asked to speak about the district's efforts during distance learning, how we bridge the digital divide, and our plan to return to campus. So we'll be talking about those three things. As you know, the Los Angeles Unified is the second largest district in the country. Almost 80% of our students are from families living in poverty. And we have about 70,000 students that have disabilities, and about 20% of our students are English learners. Almost 20,000 students experience homelessness on any given day, and about 8,000 students live in foster care. So I know we share that there's no greater imperative than getting students back in schools and being able to do that safely. Our youngest students need to learn how to read. Our students need opportunities to learn English, academic English. And our students with learning differences and disabilities who may have been struggling before schools closed need to continue to have those opportunities in our classrooms. But I know you also know that we can't return until it's safe. So unfortunately, the overall COVID level in the Los Angeles area remains above the state level for returning safely. Current state guidelines say that the number of cases in Los Angeles would need to average about 700 or less for 2 consecutive weeks before schools can consider reopening. And currently, our county daily average over the last week has been close to 1,000 new cases a day. So distance learning, when we closed schools last March 13th, closed campuses rather, we made the commitment to keep every student connected to our community. So we made a significant investment in devices and internet and instructional materials for all of our students, as well as support to repair or replace any devices needed. Hotspots can connect as many as 5 devices at a time. And they're little portable devices that have been passed out to families from schools. And that provides connectivity, as well as some of our devices have LTE connectivity. But even with that, you know, we find that service could vary from location to location. And sometimes something as much as an outlet, access to an outlet, an electrical outlet, can inhibit students from accessing, being able to recharge a device or recharge that hotspot. We've moved the vast majority of our curriculum online, as well as our assessments. We've offered over 20 hours of professional development to all of our teachers, an additional 30 hours to over 13,000 educational leaders in our district. Several thousand teachers opt to teach from their classrooms every day currently during distance learning. However, teachers do have the option of teaching remotely from any location, either home or school currently. Our teachers have been equipped with devices as well as our earliest learners are currently receiving devices in our early education programs. Our school principals, our assistant principals, our counselors, our support staff are working hard every day to reach out to our most vulnerable population. And I have to say, from last spring to this fall, we evolved dramatically. This fall, you should see regular schedules for students and families, daily instruction, daily attendance, and a variety of supports for our students. And we also made the decision at the outset of this crisis to provide meals to any family, no question asked. And because of that, we've served over 70 million meals to date since last March, the largest school-based relief history in our nation's history. But our plan to reopen continues in phases. So I'd like to share a little bit about what we've done and in the planning phases. We have put filters in all of our classrooms that are equivalent to an N95 filter so that our filtration systems are up to date, state of the art. We've purchased electrostatic machines to clean and sanitize schools and classrooms from top to bottom. Personal protective equipment is being provided to all individuals on campus. And we've reconfigured our classrooms to keep the desks a safe distance apart. As you know, at the county, there are 3 ways to be able to return to campus. Small group cohort, up to 10% of your school for vulnerable populations. A K-2 waiver process, which requires a letter of support from labor partners, and childcare. To date, we've begun our one-on-one tutoring program, which was a big step for us to bring students back on campus. And we have over 222 sites offering one-on-one in-person tutoring. That's teachers and paraprofessionals working with students to personalize learning for particularly students with disabilities, English learners, students in foster care, and also for students experiencing homelessness. We've also begun one-on-one assessment for students for some of the same populations, and including gifted identification, and hybrid instruction in our adult ed career technical education programs. We know, though, that in order to get back to where we need to be, we have to be able to ensure safety. For example, in order to do what we've done currently, we've had to ensure that we have COVID testing available for everybody. So before teachers and students both start tutoring programs, they participate in the COVID testing program. They're notified. In fact, I just took one this morning, today myself, and I'll be notified within the next 24 hours of my results. And then if I were in the classroom, then I would be notified that I can go back and I could begin teaching in the classroom. So we needed to make sure that we had all those pieces in place before we could start. Upon arrival, students would check in, they get their own bag of supplies, so there's no cross-contamination. Students and teachers meet together, either outdoor in a covered area or inside a classroom with adequate space and ventilation. And students right now could be getting support in maybe learning the letters of sounds, dividing fractions, or something more complicated, such as learning to calculate the slope of a line. And that is personalized to the needs of the students. Cohorting is incredibly important for us right now. We're working with Johns Hopkins University, UCLA, and Stanford University, amongst others, to ensure that once we return to school, students stay in that stable cohort. Right now at some of our campuses, there are over 99 or 100 zip codes that students come from on buses, and students move from class to class in secondary schools, increasing the risk of spread. So we're looking at ways to contain a stable cohort across periods and looking at creative ways to do that along with our medical practitioners. And really looking how we could not only contain the spread of the virus should an occurrence happen, but also looking for a way to do efficient contact tracing should there be an incident. And again, the testing that I mentioned comes in 3 phases. As you know, we embarked on that. The first phase is an initial baseline test, which will be offered to all students and staff. And that's just to help us determine the prevalence of the virus in our communities, even prior to reopening. Second, we're looking at a return to campus baseline test offered to students at the time that they're going to be returning. And then third, periodic testing of students and staff throughout the year to reduce the number of people who may arrive on campus with the virus, as well as a daily pass application that can be used to answer the questions upon entering campus to make sure that we're all in the habit of practicing safe behaviors. In regard to mental health, I had the opportunity to speak to over 40 secondary school student leaders this morning, and they talked about the pros and cons of distance learning. One of the things they mentioned is that it's been very helpful that we went to what we call a block schedule. So instead of going to 6 classes a day right now, or 8 classes a day, students go to 3, and they go to them every other day and for longer periods of time. So that's been helpful to students to be able to focus, not feel like they have to jump around as many classes in a single day, much more like you might see on a college campus, but that's helped them to focus. One of the things they felt that was difficult still was actually, they mentioned mental health and the stress of being in the quarantine environment and having to have a lot of responsibilities, including caring for, helping younger siblings at the same time that they were responsible for their own learning. So I wanted to mention that in LA Unified, we have 16 wellness centers, full service wellness centers. And that the Los Angeles Trust for Children's Health released a report today speaking about that, and that 11 of these wellness centers had over 230,000 visits in the past 5 years by almost 90,000 patients, many of whom had gone repeat times, showing that bond. And as the coronavirus pandemic has hit, we've remained open in 6 of those, and that there have been 12,000 visits between March and June of last year. We've opened a mental health hotline for the district 5 days a week, 12 hours a day, and received thousands of calls from the community. And we also took a pretty big leap with our labor partners and added a homeroom advisory to all secondary schools, all middle school and high schools, which is a period during the day that's not a content area, but is homeroom advisory for the purpose of checking in with students to make sure that they were social emotionally well, that they were able to access their classrooms, that they are getting college and career support. And those advisory classes are half the size as what a normal class is. So that was a big step for us to ensure that our students were being safe. So all that being said, we continue to provide universal access. We look forward to being able to work both with our city, county, local partners, our community-based organizations, as well as our labor partners. A student in every California school should be afforded the same basic resources, just like they're enabled to walk through a classroom or walk through a school gate and have a textbook and a relationship with their caring teachers. We've done our best to address the needs in the community. Some things that we've done, many are saying aren't the sole responsibility of a school district, such as providing meals for adults, connecting families to the internet, providing mental health supports, and standing up a comprehensive system of testing and contact tracing. So there's several points of opportunity and collaboration that we look forward to continuing to work with city leaders on, and an open invitation to continue to collaborate. So thank you for having me here this evening. I'd be happy to take any questions.
Thank you again for meeting with us. I have a couple questions, and then I'll open up to the other commissioners. Remind the commissioners to, if you put it in the chat box that you want to ask a question, I'll know who to ask. So the 3 questions I'd like to have you address. One is, we know that you're making it available, but do we know that the students are actually online, or just clicking online and then going to do something else, so that they're not necessarily on a screen or learning from the classroom? And then B, that what percentage of students are in fact actively partaking and not getting dropped from calls or links or things of that nature? And then I'll ask my other questions after.
Great, thank you for that. So first and foremost, yes, we do monitor not only attendance that teachers take, but also student participation versus, by way of unique login. We're also able to see how long and how often students engage, not only in a webinar type style like Zoom, but also in our learning management system called Schoology. This year, the district was required to complete a plan to the state called the Learning Continuity and Attendance Plan. And in that plan, we were required to identify assessments for English language arts, math, and also English language development. So teachers have assessments that are being used to gauge students' academic status at this moment and what gaps they need to complete and fill moving forward. It'll help them drive instruction. So certainly we have those tools in place, and we're, still in October, there's been an extension in that timeline. For example, from the state, they've extended the timeline by 45 days. We normally have 30 days to do assessments. This year we have to the end of October to do assessments, just because we're learning how to do those online, which is a different process for teachers and students. But we look forward to having that data to really drive instruction. And I'm sorry, Dr. Mandel, your second question was?
Well, the second part is, do you actually have the numbers? Do you know what percentage of, say, elementary school students are actively participating on a daily basis the percentage of middle school students and the number of kids in the high schools?
We do. We look at the numbers by elementary, middle, high school. We also look at the numbers by subgroup, and we look at the numbers by community. We have 42 communities in the larger district, and we share that data with our local superintendents weekly. It's available to to our employees on the data system, and we also do reports at every board meeting. Every regular board meeting, you will also be able to hear an update on those numbers. At the end of last year, we know that about 98% of our students were able to log in with at least one unique login. This year, we're looking a little bit deeper at the different, not only logging in, but are they learning? Are they able to continually access learning? We're hopeful with the data that we see. And I think that, as expected, we see slightly less connectivity and interaction with student groups such as our youth in foster care or our youth experiencing homelessness, our youth in more vulnerable categories. And then that's part of the district's push to re-engage all of our parents, all of our students. And we have a plan for re-engagement that our student health and human services personnel help, our principals, counselors, TSA counselors, psychiatric social workers can actually know by the name of the student who needs additional support to get connected and to get re-engaged. And that's really important that we have that level of transparency.
So if you look at not necessarily the tougher, more difficult students to reach, but the average all Los Angelino kind of kid, knowing that we're a very diverse population, are we getting 95% of the population signing in on a daily basis?
I would say on average, I could check the numbers right here, but on the average, we're above 90% for sure in terms of attendance on a daily basis and students logging in. And it's pretty much slight differences, but it's fairly fairly similar to what we would expect in a normal year in terms of the number of kids attending. With minor discrepancies, but overall, most of the students are able to connect. And of course, there's always going to be the daily, student popping off and then popping back on, or a teacher dropping and dropping back on. That's happened to me on occasion. But we've been able to move through that. I think I've talked to several teachers in the last week that feel like they're really in a groove now, and they're able to make connections with their students. They feel like they know their students. More students are turning on their cameras because they feel more connected. And we really worked hard at the beginning of this year to develop what we called the Smart Start at the beginning of the year, where teachers built routines and procedures, built community. We have a lesson for every day at the start of the year for building that community. We call it also Mindful Monday, Grati Tuesday, which is about gratitude, Wellness Wednesday, and every day of the week, the teachers have lessons to pull from, also to just build that connection. That's what we were so worried about being online at the beginning of the year. And students that I spoke to today felt like they were connected to their teachers. It's not the same. They don't feel like they're able to connect to their peers as much as they would in normal situations, but definitely there was a feeling of connection to their teachers, which we were glad to hear.
Wonderful. And then my last question is, you'd mentioned that the state gives you some magic number of 700 cases in the county before you can even consider opening or plan to open. Have they given you any scientific rationale or medical epidemiologic data to say why 700 is the magic number and not 1,000 or 1,200 or 1,100 or 800?
They may have. I'm sure they have. I'm not the expert at the epidemiology portion of this. What I do know is that they've assigned colors to the different tiers, and we're not in the tier yet. We monitor it weekly, and we're not in the tier yet that we're able to, fully return to campus. That being said, we want to be absolutely ready when that does happen. And there have been, we're in a slight increase right now, but we're not increasing as much as other states are. in terms of spread. And so I think that looking at the bigger picture, we just want to be all set to go when it is in time, when we do get that go ahead. And at the same time, we will get the go ahead and then find out that we have to toggle back to distance learning. And that's happened in a number of states and a number of districts across the country where they've started school and then had to revert back to distance learning. So in our planning, we're being really careful about being able to toggle back and forth if needed. If a class needs to revert to distance learning, perhaps a grade level, perhaps a school, and that's why we want to maintain those strict cohorts of students.
Right. Well, I applaud you for being flexible, or the district to be flexible in planning as well as you guys are. I think that we should all be very proud that you're working so hard to do that. I would say that I think that the 700 number is totally arbitrary. The state has not given us a rationale why it's 700 versus another number, whether 600 or 800 or 1,000. I would say that this commission is very concerned about students who become disenfranchised and end up not learning. And as you know, kids who get held back or don't make progress have a much higher rate of never completing their high school graduation, and that those students are more likely to end up incarcerated. Those students are more likely end up in poverty. Those students, if they're female, are more likely to have significantly more kids of their own, and a cycle of poverty and issues go on. And also, if you look at certain populations, the foster kids and communities of color are more susceptible to those problems. And we're very much concerned that we give the best education that we can to every single kid who lives in the city of Los Angeles and goes to not just LAUSD, but also independent schools and parochial schools and other schools that are in the system. So Commissioner Shannon, you have a couple questions.
Hi, first of all, thank you so much for coming today and addressing our commission. So I have a few questions first about the testing. So for the baseline testing, which happens before the schools open, that is voluntary, correct, for students and teachers who are not necessarily teaching on campus, correct, and the support staff?
Correct. We're encouraging people to take advantage of the testing opportunity now, and I think we've reached the 50,000 mark where we've given 50,000 tests since we've begun just a mere few weeks ago. So it is rapidly on the move, but correct, it's voluntary.
And the availability of the test, there's equity among different neighborhoods or different areas.
Yes, absolutely. We've been very intentional about ensuring that it's accessible in different neighborhoods, as close to, in every community, in every 42 of our communities, that there are testing sites. The appointments are done so that there's very little to no wait. We don't want people congregating at the test site. So it's very organized in that way. There's, no contact with anybody. Everything's cordoned off. Everybody has the personal protective equipment. Really, I think today, I went and I was in and out in about 7 minutes, and did not see another person, although the appointment schedule was filled. So, it run very efficiently. And I've heard similar comments from other people that have gone as well.
Great. And the testing sites are at the schools?
Yes, we're using our school sites.
Okay.
Primarily,
all of them. Is there like a list that's available online? Is that how people find them, or?
Yes, there is a list online. And I believe when you go to our homepage at www.lausd.net, you can find a list there.
Great. And then, and what kind of test is it? Is it like a blood test where they prick the finger, or is it a swab, or?
Right now, the most common test we're using is the nasal swab. and it's the Q-tip. And unlike the stories that we've heard, it doesn't need to go up that far. It's not uncomfortable. You get to do it yourself. So, you know, the nurse is all covered and hand, you know, you pick the Q-tip out and, you know, you self-administer it. And then, you know, 15 seconds basically in each nostril with the same Q-tip. And that's the test.
Got it. And then the next step is the testing to come back to campus. And that is mandatory, correct?
Well, we're looking at different ways to be able to do that. I know that, for example, if a family or an employee wants to use their own provider, they can opt to do that within 72 hours of returning to campus. So there are different, it's not quite as simple as just saying you have to use the district system, but yes, we're looking at having everybody take a test before returning to campus.
Got it. And then can some students go back to campus, but some stay with distance learning? Or will it be mandatory, like when we reach the 700 threshold, right, that we're looking at, will it be mandatory that students come back to campus, or will some still continue to be in distance learning, like a hybrid?
That's a great question. We're actually going to be doing a survey shortly to all of our families, and families will have the ability to opt in to what we're calling hybrid instruction, or to stay in remote distance learning. And that's primarily because prior to vaccine being ready, we do have students that are in high-risk categories as well as adults in high-risk categories that aren't comfortable or able to come back fully. We also have students, perhaps because of a disability, that aren't able to wear protective equipment on their face. And so each situation is slightly different. So we want to make sure that, you know, we're able to meet the needs of all of our families and employees at the same time. So certainly they will have a choice as to whether or not to participate in hybrid learning or just stay remote.
Great. And then once we reach that 700, you know, per week in terms of COVID cases, how much time will parents have from reaching that 700 mark to when the schools open? So will it be like a matter of a week? Will it be 2 weeks? Right away? A day?
I know. The timeline is still not determined because there are a lot of moving parts associated with that. For example, if magically the number hit the mark tomorrow, you know, we still have to give the survey, for example. So some of it depends on, you know, the timing of multiple factors. The plan is for us to be able to give the survey and, you know, complete all of the necessary scheduling that we need to do on our end so that we do have adequate time and adequate notice. And we're also continually currently in labor negotiations with our labor partners. So we would need to finish negotiations prior to returning as well. So we're on an aggressive timeline to be able to do all those things so that when and if the number gets to the point where we can return, that we're able to.
Got it. And then you talked about the wellness centers, and I think you said 6 are open. What areas are those wellness centers in? Like, are there any in East LA? Are there any in South LA?
I would have to check on the exact locations, but in terms of the overall district, we have put wellness centers in very strategically in different parts of the city. One of the things we recognize is that our district's very large. We have 710 square miles across the district. And this year we made an intentional effort to actually move into 42 communities instead of even staying in 6 large regional areas. Prior to this year, we were in 6 regional areas: East, West, Northwest, Northeast, South, and Central. Even those areas were large, up to 100 schools or so. And for a parent to get from, Southgate all the way up to Soto Street could be almost an hour bus ride, even within a regional area. So now we've broken up into 42 smaller areas. And the goal is to bring the resources to those small communities so that parents really do have a local office and a local administrator overseeing their community Carson, for example, has their own school community with their own school administrator with an office in Carson, so that they can have that relationship. The small businesses can also have that relationship with the schools, as well as the different service providers, health and human service providers.
Right, but the wellness centers themselves are 6, and we're guessing there's at least one that's in East LA and maybe one in South LA.
Yeah, Susie, I would have to check on that for you. And if there's a way I could get you that information, I certainly can share that afterwards.
Okay.
As to which
And
one
then, for the period of instruction, are cameras mandatory? So do students have to have their cameras on, or is that a voluntary thing? Because there seems to be a lot of question about that, particularly at my daughter's school. So yeah, how does that work?
Yeah, that's a great question. That we did a lot of research around that and looked at different schools across the district, across the country, actually, rather, and made a decision that we were going to highly encourage the use of cameras for students, but that we weren't going to make it mandatory. And part of the reason was because we do have many students that are in situations where they're experiencing homelessness or in transit homes, and really wanting to ensure that students didn't feel nervous or worried to show their backgrounds or what was happening perhaps in their environment. We have many students that live multiple families to one residence, and so there's lots going on behind them, and we can see, you know, in some cases that's been when trust is built, in many cases, that students decide to turn their cameras on. And that's what we were hoping from the beginning, that teachers could build that community of learners and that students will feel safe. And that we've asked our teachers to also have strategies like teaching students to have a virtual background, teaching students to, you know, have their back to the wall so they can turn their camera on and just see the wall behind them, as opposed to everything that was happening in their family. But it is still highly encouraged, but optional for students. It's mandatory for teachers to have their cameras on.
Okay, great. I have some questions about your homeless students. Well, actually, if I could go back to the digital divide issue. So what percentage of students just don't have any access right now to the internet? So there must be some, and I'm guessing this is sort of crosses over with the homeless population, who don't have access to electricity, or for some reason are in a spot where they're just not getting internet. And do you know like what that percentage is? And this would be different than attendance, right? Because attendance could be, you know, a child's not getting on because they're sick or something. Whereas someone who just has a barrier because they can't get on the internet, what percentage would you say of the student population currently just doesn't have access to school right now?
I'd say first and foremost, that's been our stance from the beginning, is that all of our students should have access to the internet. So there really shouldn't be any students that don't have access per se. You know, everybody should have that remote, the hotspot that can get them on. And we've actually changed our policy from providing one hotspot for every 5 devices to, if families are experiencing difficulty and overload on the device, on the hotspot, that we would give more hotspots, maybe one for every 2 children or one for every 2 devices, so that we can make sure that students are getting on. And I think each situation is slightly different depending on the student's situation. Most are able to get access to a place to recharge a device or recharge a hotspot. But I did share one example of where, you know, it was reported that is still a challenge for some that don't have the stable home stability, housing stability. So those are, I guess, examples that continue to push us to find alternate solutions, such as not having to rely on hotspots, for example, you know, and perhaps that's a place that we can collaborate for all the districts in the city and the county in terms of being able to provide other types of internet access that wouldn't rely on a device, for example. And our support staff, that's really been their passion, is to reach out individually and just try to problem solve each individual case, and how we best support each family, to the best of our ability. And I think that includes our next steps being, able to provide a space for students to come back, even if we're still in distance learning, but to have a space for students to come back, just a quiet space that has access to, internet or electricity or outlets, even if they're still learning remotely. So that could be on our campus. It could also be, a collaboration with the city or the county in terms of having a space, for example, like a library, a public library, to have a space to learn in quietly. So we would welcome those conversations as well.
Got it. And that's not happening now. That's just something that you're looking at, correct?
Correct. We're in discussions, yes, in the planning phase.
Okay. Okay. And then I just finally wanted to talk about homeless students. I'm guessing, so we know that there are students who are living in their cars or maybe on the street. There's students who are living in motels, students who are doubled or tripled up with other families. So what, if you could just very quickly go over what are the resources that are provided, whether it's through the county services, through LAHSA, through the city, through the district, the LA Unified School District. So if you could just sort of outline very quickly what those resources are.
Well, I think that we have a number of family resource centers to support families in that situation. We have a dedicated homeless support unit in the district that also works with our PSA counselors and our PSW counselors to support students in those situations. Our schools are aware and very sensitive to the needs of students in those particular situations. And I've witnessed our teachers being sensitive as well. We've asked in this time of, not only in this time, but particularly in this time of the pandemic, that our students that are in vulnerable populations, that their grades not be, that they not be penalized due to COVID related incidents. And last spring, as you may be aware, we did not give any Fs to students in the district because of that. And we weren't able to, it took us some time to get the technology and the devices out to all students across the district. We had to purchase them to begin with, and then roll that out. So while we did that expeditiously, there were times where we know students didn't have a device that we provided from the day we moved off campus. So for that reason, we had a different grading policy. This semester also, we've gone back to pre-COVID grading, but we also have almost implied statement of empathy in our grading policy that says, a student shouldn't be penalized for a COVID-related incident, which would include being homeless and, having to move due to housing instability, and that teachers would be more sensitive to the needs of students in that way. But we do continue to work with our county partners and our city partners, as well as in the district, to support our students experiencing homelessness.
And then are there sort of just basic needs, I know there are a lot of backpack programs. I know there's probably, I would guess, clothing. We know about the food programs. Is there anything else? I would guess maybe special counseling.
Well, our counselors are all available currently. We've continued it towards the end of last year to do virtual IEPs. Our related services are all moving, virtually. We're moving to the point where we can support students, for example, with college applications and financial aid applications, DREAM Act applications, where they can get support online. So again, just being really intentional about the supports that we know students need because they're not physically at school, and trying to over communicate those opportunities. And I think that continues to be a need. So for those community-based organizations that might be listening tonight, please do reach out, because we are wanting to over communicate these opportunities to students. In a normal situation, they may not hear it in person, or they may see something hanging in the doorway, in the hallway at their school. In this situation, we just want to find every avenue possible to get the resources to students, which includes over communicating, not only in English, but in multiple languages. And sometimes that's best done by partnering with our community-based organizations as well.
Great. And then just lastly, those 6 wellness centers, I can find those on the website, correct?
Yes. And if anyone listening or on the call today would like to email, you can email instruction@lausd.net, and we can get right back to you with information that you need. Instruction@lausd.net.
Thank you so much.
Thank you so much.
I'm finished. That was my last question.
Thank you.
Thank you. And you can also, Allison, you can always give information to Rita, who can disseminate to the entire commission if there's information you ever want to follow up or give to us. Commissioner Kato, you have some questions.
I'll try to just keep it to one. In July, well, thank you very much, Allison, for taking the time to be with us and explaining everything thoroughly. In July, we had the LA County's Deputy Superintendent of Education. He was trying to give us an update on procuring PPE for all the unified school districts in Los Angeles. And one of the questions that came up was if, how much plexiglass was in that. And, he just said, wow, that's just going to make it way too expensive. And I know some of the schools out in the East, they have it out in the classroom, not only for the teachers, but even for, certain students. In here on the West Side, I, checked with one of the elementary schools, and I think there was enough for the office, but not for the classrooms. And I asked the stock of PPEs available. And, right now, all she has is like the office staff and the teachers that are interested in teaching from their classroom. So she was saying, well, what we have on hand now is okay, but if school starts, I'm sure that supply is going to run out within a month. Okay, so my question is, how is the district, planning to increase the procurement of these PPEs? So once there is a greater number of people coming onto campus, there's not going to be this stress about not having enough. And if you have to work with the county to make sure that this is going to be coming in a timely manner, because, according to the news, entering into this winter flu season, I'm sure that, all of the hospitals are going to be needing a lot more too. So, and if we're talking about, the schools, it's probably, not as high, or, the cost is going to be a lot more expensive. And I know LAUSD Buettner's has invested, I heard, $150 million to do the testing. And you're using a lot of that money for the testing, which is important. But I think, to continue once you open up. And so that, along with, why isn't LAUSD, instead of waiting for the state to allow in-person teaching all at once, they're allowing for waiver applications for kindergarten to second grade. Just apply for that. Also, 10% of the schools, students with special needs could be on campus. And, if you work with, these smaller groups coming on now, you can sort of figure out the logistics of when everybody comes on.
Correct.
So, why isn't LAUSD, thinking of, I heard that LAUSD was one of the districts that haven't applied for any of the county waivers. So that's my question.
Great question. So a couple of things. One is that's exactly why we brought the one-on-one students back for tutoring. And at the beginning of October, is we wanted to start to pressure test really our testing ability, which is all going well. Our ability to not only test teachers, but test students. We have like I said, the N95 equivalent of the filters in there. And actually there's some study that has shown that the plexiglass actually restricts airflow in the classroom, and there are additional surfaces that can hold the virus and potentially need to be cleaned. So we have a strategy right now where that N95 filter is the air quality in the classroom is good. There's good air movement and filtration in the classroom, and so there are other districts that have taken different tactics, but that's been ours, as well as the electrostatic misting that occurs in the evenings to sanitize the classrooms. Another reason is that we started the flu shots this past week, if you might have seen in the news, for that reason as well, to try to keep the flu season as controlled as possible, along with COVID happening at the same time. We think it's a multifaceted approach to that. And then, so I do want to say there has not been one public school to date. Last I checked was Friday. Today's Monday. There's not been one public school that has been approved for that K2 waiver yet. And I know that the Board of Supervisors is looking at a possible, in looking into the process of that. And the reason is because it does require those letters of support from the different labor partners. And so even if we had applied, again, we're still negotiating with our labor partners. So it's, I believe as of last Friday, there were only 4 schools in the entire county that had been approved, and they were all private schools. So we look forward to that process. We are aggressively planning for return for all the reasons that you stated, for PPE. The state and the county will provide a portion of the PPE that we need, but we are stockpiling because we know that we're going to need a lot of it and that there's no room for error. We have to have not only enough, but we have to have extra. And if there's one thing that we've learned in this COVID environment is that nothing is necessarily always going to be available. We had to procure a lot of devices really fast, and there was a shortage on devices. We had to procure a lot of PPE fast, in shortage conditions. And even now we're looking at different types of equipment for the classroom, and, there are shortages because pretty much everyone is asking for the same type of thing. So we really had to plan ahead to have adequate stockpiles to return. So rest assured that that's happening.
Okay. Thank you very much.
Thank you.
Commissioner Limis, you have a question.
Thank you. Well, thank you again for that lovely presentation. And I wanted to pose a question that was following what Commissioner Shannon identified about how to amplify the services that is offered to community, to students and families, and thinking about if there has been a consideration to work more closely with federally qualified health centers or community clinics. There's almost 200 of them throughout the county. And in thinking about the Latino population, right, 73% of your student population is Latino, who have been disproportionately affected by COVID-19. If there has been a consideration besides the 6 wellness centers and now the 42 community administrators that you're going to have, how you can work closely with community clinics that are already serve these communities that are underserved, underinsured, and uninsured. And so, making sure that that is something that is considered in terms of, who's on the front lines and who already works with this vulnerable population. So question, statement.
Thank you for that. Thank you for that. And that really is the vision of the communities, is to be able, I mean, sometimes, in the past, we would find that there was a source center right next to a school, right? And the community was so large that folks weren't necessarily able to have that dedicated conversation about support services. So in this model, we're absolutely going to be able to tie, our superintendent statement is the schools are at the center. So thinking about our schools as the center of where all of the resources can coalesce, bringing those resources to the school, increasing those relationships with our schools and the resources that are just down the block in their community, whether they're city resources or county resources or other resources, is really exciting for us, because it does really take a village to support all of our families. So thank you for that comment.
Commissioner Hisserick, you have a question.
Yes, I do. Thank you. Thank you for your attendance and being here, making your presentation. As I go by the neighborhood school, I see some action going on. I'm not quite sure what it is. What is going on at the typical school? I mean, anyway, I'm not sure.
Well, I think it depends on the level of the school. But right now, you may see parents at early education centers coming to pick up devices. Our device distribution for K-12 was last year. And our early education students, we fought really hard to make sure they got devices. And so those, partially because of the delay, worldwide delay, we're just finalizing this week. So you may be seeing students picking up devices so that they can engage in online learning. Some schools are also passing out instructional materials. They may make packets of materials for students to take home to supplement their distance learning. You might see the tutoring, students coming for tutoring in and out. There continues to be cleaning happening at schools every day. We have, again, employees reporting to work, many of whom are teaching from schools. And we, again, are kicking off, this would be virtual, but our small group tutoring on Saturdays, our small group tutoring in the afternoons during the weekdays from 2:30 to 4:30. You may see teachers reporting to work for that, but there's lots going on. And our crews have maintained over the summer providing clean campuses, their air filtration. We have food distribution sites beside the 63 grab and go centers that had distributed the 70 million meals. We also have students, can pick up with a meal card. They all got their meal card in the mail. They can go to pick up food during the day as well, a breakfast and a lunch. And so we really want, again, our schools to be a resource for our community. And as soon as possible, look forward to bringing back more students.
Okay, thank you very much.
Thank you so much.
Commissioner Kalfani, you have a question.
Yes, now I think it's just a clarifying question. So you mentioned there are 6 wellness centers, but also just there in the question that Stephanie brought up about the FQHC. Many of the wellness centers are operated by the FQHCs. I know, at least in certain areas. So when you say there are only 6 wellness centers open, can you say something? What does that exactly mean when I know that many of them are operating?
Perhaps I'm just referring to the ones that are on school sites. I don't know, maybe I would want to follow up with Rita with more information on our wellness centers. I don't directly see our wellness centers, oversee our wellness centers. So I would be more than happy to get all the detailed information to you about them and what they're currently doing and who we're currently collaborating with. We're excited to grow our ability to serve the community with full service wellness centers. The one I visited most recently, has it up. Kids can get their eyes checked. They can get their teeth checked. They can get their vaccination. It is really full service.
Right.
And other campuses, will have they are collaborating with partners. There are also wellness centers in the community that are not on our campuses that serve our students as well. So
Okay.
perhaps Commissioner Kalfani, I could get detailed information about that and share that back with Ms. Moreno.
Okay. Thank you.
Okay. Thank you.
Are there any other commissioners or another commissioner who has already asked has any other questions before we close this agenda? Seeing none, Allison, thank you very much. If you can see as our next item on our agenda is actually about homelessness. And one of our charges is actually to address the healthcare needs of homeless populations. Given the large percentage of homeless kids and families that are involved or connected to LAUSD, we'll make ourselves available to you and to your other senior staff. We're willing to work with you guys to try to address the healthcare needs of the homeless population that is in schools. And so if there are liaisons between your homeless population or experts within LAUSD who specialize in reaching out to the homeless population, we'd love to have them come to our commission meeting when we discuss homelessness to either present what's going on in LAUSD or to work with us to better improve the healthcare of the homeless population in the city of Los Angeles. So again, thank you for presenting tonight. You do not have to stay on this commission Zoom, Google Meet. We totally appreciate what you're doing for the kids of Los Angeles and meeting with us tonight. Thank you very much.
Thank you. I'd welcome the opportunity to stay on and listen if you don't mind. I still have my second grade paper that says I want to help people experiencing homelessness. So thank you so much for the opportunity.
You're welcome. You're welcome to stay on. And in fact, we meet monthly. You're welcome to always come in as a representative of LAUSD and or public to have your voice heard. So
thank you so much.
Thank you.
Thank you, commissioners. Thank you.
I'm seeing no other questions. Let's move on to item number 2. Discussion of the council motion, Cedillo, Krikorian, relative to the request that the City of Los Angeles Health Commission hold hearings focused on people experiencing homelessness and the delivery of health, mental health, social services by the County of Los Angeles, the LA Homeless Services Authority, and other non-governmental partners, and potentially our commission ourselves. Any conversation, discussion by the commissioners?
I have something to add, Commissioner President.
Please.
So I just wanted to let you know that the Homelessness and Poverty Committee heard this item. They approved the motion, and it's going to be heard by council tomorrow.
Excellent. Great. Thank you. Commissioner Shannon, did you want to speak?
Yeah. So it looks as though our charge really is to provide, I think, to start with a hearing, which I think is great because I don't think that we spend enough time discussing a lot of these issues in the city. And I think, I would be happy to help lead the charge in terms of putting that together. But I think, just looking at the various elements of it, obviously we want to talk to providers who have a unique experience in terms of working with this population. But I think it's also very helpful to speak with people who are both currently homeless, provided that they have, the device to get on remotely. I think most of my clients do. And people who are also formerly homeless. Because I think one of the things that we need to do is really to sort of document to the barriers for most people in terms of getting health care that they need, and also getting housing And there are a lot of barriers, and there are providers who and people who, work at the city and the county, who can explain to you how things are supposed to work and how, certain systems are set up. And then there's the reality of how they do work for somebody who is experiencing homelessness. And I think we have a very unique opportunity here to be able to hear, what systems are in place, what models that we're using, and then sort of the user experience, if you will, of how in the real world, these barriers for people sometimes cannot be overcome.
I think those are good points. Any other commissioners want to comment? As you all recall, our 2020 commission report had a significant portion of its report on homelessness, as well as the issue of healthcare applying to the homeless populations. So I think we need to clearly address it in a commission meeting. But in addition to that, I make it available to all of you to look at that, not just that one segment and section of the 2020 commission report, but the entire report that we released and submitted, but also other areas that you'd want to address in a deeper dive, and communicate with our stellar interns so that we could build a better and a more modern, updated commission report for 2021. As we blink, time is flying by, and we'll be into 2021. So we can address not only homelessness, but also the other issues as well. And so I publicly asked the commissioners to reread our report from last year, speak to our interns, get involved with it. If there's areas that you want to address that we have not addressed previously, please let us know. And then there's also areas that we have addressed that we should go back and update with either commission meetings or from other fact-finding involvement. And homelessness clearly is a big portion. We're unfortunately the homeless capital of America. And the healthcare needs of that population is unfortunately quite significant. The morbidity is worse, mortality is worse for every single disease. And COVID has unfortunately impacted that community as well. Though COVID has actually hit that community a little less than people thought. That might be because they're outdoors, but it'd be interesting to see, unfortunately, what's going to happen as the weather changes, that population might be theoretically more vulnerable as the weather changes and they go inside in shelters. Shelters are potentially high-risk areas. Any other commissioners want to comment on this agenda item? Commissioner Shannon, you're back up.
Yeah. I'm just wondering, do I need to make a motion to have the hearing for the next, to add that to the next, to the agenda for next month?
No, I mean, you're welcome to make a motion if you like. I don't think you necessarily need to. I think there's a consensus that homelessness is a really big problem. It's something we have addressed annually. It's clearly a big issue. It's something that we have talked about beforehand. Currently, we do not have a major topic for the November meeting. So I don't, unless I see, people shaking their heads no, I think we could do this without a true vote.
Great. And if we could give at least an hour and a half to the hearing, I think that we could get all perspectives, not all of them, but a lot of the major perspectives coming forward, including some folks who can provide some solutions.
Yeah, I think that we don't time limit things, we can have one agenda item with multiple divisions to it, so that we can have multiple presenters and a very serious and intellectual discussion of the commissioners with those individuals.
Great.
It's actually a little easier now with the Google Meets. There might be people in Washington or at HUD that are experts that might be available for us. And there might be potentially people internationally who have actually addressed and have success that we could rely on too. It's something that we couldn't easily have done pre-COVID with in-person testimony.
Yeah, and I'm in touch with some folks in Washington, D.C. for national stakeholders that I could reach out to.
Great. Yeah. So if you don't mind, why don't you connect with the 3 interns, and so you can help them, and they're more than willing to work with you, unless you want to reach out to people that you know in DC, in order to get suggestions of individuals.
Okay, sounds great.
Any other comments? Any other commissioners? Commissioner Cotto.
Yes. Yeah, I sort of like one segment to be dedicated to like these, LAUSD students too, as a follow-up of, I know we look at the county, but our responsibility here is within the city, and I think Rita wrote a comment about maybe getting some of the students and their parents that are experiencing homelessness and the difficulty of getting online, getting a perspective of that, and maybe how we can be helping bring more light to that situation. I mean, we talk about homelessness; it's just such a wide area. Just as a follow-up from today's report from Allison, I'd like to, at least suggest we give some time to the students and their families that are experiencing homelessness in LAUSD.
I think it's a great suggestion, Ron, and I also think that if we're going to have them talking about the difficulties that they have in regards to their education, but not only that, they're whether they're having difficulty accessing the healthcare system. But we can set up the commission meeting so that we have experts talking, but we also have presentations or discussions from individuals that would be on this portion of the Google side as opposed to the Zoom side, so there can be a give and take and that they can answer questions directly from the commissioners. I think that would be a wonderful idea, kind of novel way of using this. We might have to work on, and we might ask the city tech people to help us how to do it. The way I see it with Google Meets is there's only 16 boxes or faces at one time. If the number's going to get bigger, is there a way that we could set it up so that we can have more, so all the commissioners can be on at the same time? If we're going to have homeless families or together elsewhere, we're not going to put all those people together in one room. Obviously, that would be, from a COVID point of view, unwise. We want to have multiple little boxes of those people who are presenting. So we have to be somewhat creative, and maybe between now and the November meeting, we can work out that or figure out from a technological point of view how to do that so it's efficient and still educational to all the commissioners. Any other commissioners have a comment on this?
I have a comment, but I think Rita wanted to get some clarity, so I'll let her get her clarity before I make my comment.
Thank you. What I just wanted to add is that, so the council's intent is to find out, are the services getting out to the folks that they need to get out to? The bigger question that the city is also looking at is, should the city have its own health department so that we can focus on the needs of the folks in our jurisdiction and the types of services that are supposed to be out there for people who are experiencing homelessness? So I think that, if you look at it this way, in a two-pronged way, if you want to talk to some of the experts in the field to talk about, the type of services and the delivery of those services is fine. But I think they're looking at, they want to know if people here in our city experiencing homelessness are having access to the services from the county, from LAHSA, from the different agencies who provide, who are getting funds to provide those services. And that's a little bit of a difficult thing to do, because it's how do you get that input from them? You're going to hold the public hearing. How do you get that input from them? So you're looking at identifying who are those organizations out there that are working with this population who can, number one, who can provide that insight based on their casework with the folks that they're servicing. Perhaps even inviting a family or an individual to participate in a meeting and provide that level of, first person testimony. So it's identifying who those organizations should be that you reach out to include them in this public hearing, and who are in the families or individuals that they can identify. And so that's part of your public hearing aspect, aside from your expert panel. So I just wanted to make sure that that it was clear that you want to get some input about what's happening on the streets today, right now.
Thank you for the clarification. What I would also say is that there's two other big meaty issues there. One of which is the homeless issue and healthcare of the homeless population. And I think that getting input from them as well as experts is imperative. And I think that connecting with LAUSD, because they have a significant percentage of population and that they're a great liaison to, individuals who care about their kids' education and might be willing to present for us would be nice. Additionally, like the Saban Community Clinic has an outreach program, and they actually have input from homeless populations so that they make sure they're doing best practices for that population. So we could reach out to the people from Saban Community Clinic. I can make connections for the interns to do that. And I'm assuming that the federally qualified health centers all have homeless outreach programs as well. And so there might be liaisons from the federally qualified health centers that we have contacts with to do that. And then lastly, we've previously been presented to by the UCLA School of Nursing, which runs a health clinic downtown in Skid Row. And they have nurse practitioners that go out into the community. They would be a great resource as well, either or have one of their people present to us there. And the other thing I would say is that because that's so much to carry in one meeting, I don't think we should have another agenda item for that one meeting. But then in regards to the other big topic, which is should the City Health Commission have its own health department or alternatively this commission staff, I think that would be a wonderful separate meeting that we could have. And potentially if we put homelessness as target number one for the November meeting, then our December meeting could be addressing the other issue that you brought up, Rita, and I appreciate that as well. Commissioner Kalfani, did you want to make a comment or present something?
I will pass because it's actually not on homelessness, but I think Susie and a couple other people in the chat look like they wanted to respond. So I will hold and let others that are reacting to this topic.
Anybody else want to talk about the topic? Susie, you're back up.
Yeah, I just wanted to respond to Rita. So I actually think it's imperative to have sort of the firsthand accounts of folks. That's sort of what I was saying in my opening statement, that to know what the actual barriers are, you need to speak to people who are currently trying to use the system and to find out what's actually failing, because we are failing. You know, we are the homeless capital of the United States. Well, the over 68,000 people who are homeless here in LA County, and it's just outrageous that every single year we just see, you know, an increase in homelessness, and people are not being serviced the way that we're either being told or the way that they should be. So I just want to echo sort of what Rita was saying. I'm in contact with a lot of folks because I do this for a living, you know, who, you know, have experienced these barriers or who need navigators or advocates to help them sort of get through the system. And there are a lot of advocates that I work with in various council districts who I think could also help identify folks. So I think we should be okay in terms of like having people on who are actually experiencing homelessness now and can speak, you know, the first person on what that's like. Sometimes it's difficult for providers because they're not going to sort of spotlight or amplify a lot of the problems. They'll typically talk about their programs and how great their programs are. And sometimes we won't actually get the other side of that. So I'm hoping that we can have a very comprehensive hearing so that we're actually getting to the root of the problem.
Wonderful, thank you. Commissioner Ossie?
Yes, I'd like to recommend as part of the hearing that we include the voice of our reentry population experiencing homelessness. If there are service providers specifically servicing the reentry population, I'd like to have their voice in the hearing to discuss the prevalence of our reentry population experiencing homelessness, but then also to discuss resources specifically related to reentry population and how those resources are being accessed and if they are fully funded. Thank you.
Yeah, I think that's a great idea. I think that's wonderful. Thank you. Any other comments about homelessness?
Just a question, President. Do you want everyone to send names of organizations, contacts, phone numbers to the interns to follow up, or how do you want to handle that? Because our office is going to help to, just so you know, the motion specifically directs the city clerk. Look at the language. The city clerk, the chief legislative analyst, the city administrative officer to assist the commission in this endeavor.
Great. Well, I appreciate that. Thank you. I think from an efficiency point of view, I think that all the commissioners have the 3 interns' emails. If not, Rita, if you don't mind, send it out to everybody and so that they have it. And then you can email all of them jointly. They're very good at coordinating with each other so that they won't be duplicative in what they're doing. So all the commissioners can send names and connections to them and follow up that way. And we can do that in a timely manner so that we can have a really good meeting for November. I think that's a great idea. And then any other statements about homelessness? If not, Commissioner Ossie, you had a comment.
I just wanted to say that there are like certain organizations that I can reach out to on my own, but I'll let you know like who I'm reaching out to.
Yeah. To be efficient, include our stellar interns so that they're kind of coordinating things so we don't triple over ourselves.
And just a reminder that gives us It's 3 weeks before our next regularly scheduled meeting, and we'd probably need to have the agenda ready for in the first week of November. So it's really 2 weeks to kind of get some folks, concrete confirmations on participation.
The only thing I would say we should probably discuss it is the election is going to be on Tuesday the 3rd. Do we really want to have a meeting on November 2nd? I think that doesn't make sense, given what's going on from a national point of view.
It would be November the 9th.
9th, yeah. Okay, so the target date would be November 9th. That's wonderful. I think that makes sense. Shamika, did you want to say something on something else?
No, I've already commented. Just wanted to voice of our reentry. Thank you.
Good. That's wonderful. And then going on to item number 3, any items for future discussion other than the homelessness, as well as the issue of the Health Commission's role and or whether the City of Los Angeles should have a separate health department? Any other things other than what we've previously discussed? Access to healthcare is always an issue. Hospital bedding, to make sure that we have the right number of beds and ICU beds available, is an issue that we've talked about beforehand. Emergency medical services and response time is something that we've previously talked about. Our commission report has multiple segments and sections that address issues that we potentially would want to have new meetings to update information from prior presenters. And then epidemiologic issues are ones for the city and the county that should be presented as well. So those things are all out there. I would once again ask the commissioners to re-look at the report from 2020, realize that we have an obligation and legal responsibility to have a report for 2021, look at the areas that would and should be updated and how you'd want to input that, and any other areas that you want for fact finding for the commission meetings, for future meetings for January and February. Any other comments? If not, I'll ask for a motion to adjourn.
We just have the meeting minutes from August.
Oh, they need to be voted on. Thank you, Rita. Is there somebody who
I can move approval of the minutes.
Ron,
second.
Okay, I think officially Commissioner Cotto raised his hand first, so he's approving it, and Commissioner Hisserick is seconding it. Any discussion on it? Anybody who is there, please vote in favor or against approving the minutes. I'll say aye.
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 You have to take, the clerk has to take a voice vote. You can't go aye in that. In the new system, the clerk has to call each name individually, and it has to be done that way, per Brown Act.
Thank you, City Council Commissioner. City Legal Counsel. I appreciate the update and new information that we were not informed of. So seeing that, Rita, will you take a vote count on the approval of the minutes?
Okay. Commission President Mandel.
Aye.
Commission Vice President Grimmick is absent. Commissioner Vice President Osi.
Aye.
Commissioner Avila.
Aye.
Commissioner Estradas is absent. Commissioner Hisserick.
Aye.
Commissioner Cato.
Aye.
Commissioner Kalfani.
Aye.
Commissioner Lemus.
Aye.
Commissioner Shannon.
Aye.
Commissioner Sirota.
Aye.
And Commissioner Whittington is absent. And I don't I'm sorry, I don't have the notes in front of me to know, find out who was absent at that meeting. So if you don't mind, whoever was absent at that meeting, if you voted aye, I will mark you down as abstaining.
That's reasonable. And then for the city attorney, perhaps being that at least for the near future, everybody's going to be on Zoom or Google Doc meetings. Maybe we could all vote for these kinds of things, like the minutes in the chat box, making it more efficient. That might be something you guys can talk about to see if your division thinks that's not just for our commission, but for all the commissions, whether that's approval is acceptable.
It actually isn't. I would love to say it would be for efficiency purposes. That would be terrific. But each commission is voice, so the public knows. Even if it was an election and you wanted to do it by ballot, you would still have to do voice vote. It just is. It is the rules that we're all governed under. So if you have an action item or a motion, it can't just be all in favor anymore. Not in the existing universe we are living in now.
Got it. Thank you for the clarification. Appreciate your wisdom. Thank you. Seeing any other questions? Is there? So Attorney Vaughn, does that mean also for adjournment? We have to do a voice vote for that too, or no?
No.
Okay, thank you. Seeing no other questions, do I have a motion for adjournment?
Yes, motion to adjourn, please.
Is there a second?
Second.
Any discussion on that? Seeing none, all in favor?
Aye.
Aye.
Anybody opposed to adjourning? Anybody abstaining from adjourning? Seeing none, it's unanimous. We're adjourned. Thank you for your dedication and your volunteerism.